From heart disease to diabetes, Native Hawaiians suffer from many health issues, oftentimes for generations. How can we do better at taking care of our people? Participate in an enlightening Native Hawaiian health panel, where experts delve into transformative strategies, clinical trials, and culturally rooted practices to reshape the current landscape of Native Hawaiian well-being.
Aloha kako. Good morning, lovely people. Puting Aukahi, she heard my grown-up name. I'm Halehaku's wife. That's who I am. Sorry, mo'oko, yeah. Okay, she knows me as a musician's widow, yeah, so she doesn't know that I'm a psychologist too. Anyway, okay, good morning. It is so my great pleasure to be here today to be able to bring these folks into a conversation that hopefully gets you guys talking in your seats to each other and to us out loud. We are here, and you are in wonderful company of these esteemed speakers who have spent their lives in service of Lahui, trying to uplift our health. So I'm so excited to tell you about all of them and the work that we do. I'm first going to offer my mihi, which is I'm very oahu, kalamai. I am, you can kind of tell, yeah. There's a lot of Target in my energy, because, they just released their Christmas stuff in the dollar section, so I'm very oahu. I have ohana of Maui, and so I am a humble and grateful visitor to this place, and I'm so happy to be here with all of you. Just so I know who's here, because kind of dark. Maui in the house? Can I get a hey, okay. Okay, let's see, shall we go closest to farthest? Molokai, you here? Okay, hey, up in the rafters. Lana ima. Hey, okay. We go that way first. We go Kauai. Okay. We're timid, but we're here. Beautiful. Any of my koni'ihau, manei? Anybody? That's okay. Kauai ma got you. They'll tell you what we said. Coconut wireless is powerful there. Okay, how about Hawaii Island? I know you guys, too. Okay, I was going to go by Moku because sometimes Hilo people don't answer when you just say Hawaii Island. Yeah, they want to hear Hilo, but it's okay. See? Okay, and then Oahuma, Kalamai, that's my peeps. Hello, aloha maino. So welcome to this morning sesh. I hope you had your appropriate levels of caffeine or other stimulating chatter. I'm excited to vibe with you all today after a first day that got you all revved up, both by poking at the stuff we're most worried about and also showing some stuff that gives us a little bit of hope that we're somewhere different than we were 20 years ago, 40 years ago, 50 years ago, Some things that give us a little bit of hope. So I'm hoping today that this panel continues that. As you heard from their bios, we have people here in this group who got all kind letters behind their names, We have traditional healers here. We have folks that lay hands, leo, and offer their hearts and energy to heal. We have folks that have spent their lives in service of Lahui, who mostly unwittingly, a couple of you maybe on purpose, but not really, ended up being in charge of things. Ended up having to take the lead, build their own, make their own, and spend time convincing both inward conversations with us guys here in our Lahui about health and where we are, and then outward-facing conversations where we're talking to people that are outside of our Lahui to talk about what our needs are and explain that gap over and over again. How many people in this room this month had to explain to somebody what's going on with Native Hawaiian health? Or, oh, by the way, Native Hawaiians, not just people from Hawaii. How many of you had to do that today? This week, this month? Thank you. So we have folks that are fighting the good fight. And I'm not going to make you raise your hand and admit if any of those were with people with Koko, with Kanaka. I'm not gonna, but so we know that what we're bringing to the table today are folks that have spent a lot of time not just thinking about and talking about our well-being, but waking up every day to make it better. And the thing we're gonna talk about today is some of those things they're doing, they're seen, everybody can see them. You know the doctor with the pharmacy where you get your medicine because you need it, Those are the seen services, the things you can see. And then there's also the things that are unseen. Those are those hard conversations making health important in rooms you're never going to be in, but have a real impact on your life every day. How do we get folks to support us in the ways we're asking for? How do we convene conversations so that community can tell us what they need? Maui is a place that is a beautiful example of when Maui leads Maui, things are going to be better. So listening to what the strategies you need here are, figuring out how to bring all of us do-gooders and well-wishers. You know, we want to help. Of course we do. We want to be part of the solution. We want to be part of serving. But the folks that don't show up with elephant feet are the people who listen first, yeah? So this is a panel and 2 couches full of people who listened and moved in the way the community asked. So that's going to be my toss-up. I'm going to ask you to go this way to introduce yourselves. We're just going to do like brief, each of them sharing a thought, and then we're going to mix it up and get going, having conversation instead of, you know, death by PowerPoint, yeah? Okay, Maikai, here we go.
Aloha, my name is Cory Lehano. Currently, I am the owner and CEO of Mauleola Pharmacy. I see plenty of our patients, so you guys are my fave already. I purposely did not wear my contacts, so I don't need to be as nervous as I already am. But in addition to operating a small local independent pharmacy, I also am the founder of an organization called Nohona Health, and so which is rooted and based in bridging basically the best of both worlds, traditional healing and Western innovation. So one thing that we're working on is fusing all of the knowledge that we learn over the decades of studying pharmacy and creating clean products from la'au that we grow ourselves. And so we have, I'm not sure if Bobby is here, but we have some space that we're preparing some medicine, you know, so we're looking forward to that. But slide. So, can you turn on the slide, please? Mahalo. Okay, so you know, I prepared my few slides with the intention of conversing with all of you, but I guess it gets kind of crazy, so cannot converse or write cards. But I would love to speak with all of you guys face to face, because that's really, for me, I work and do my best work in the trenches, and doing it on the ground, boots on the ground, and conversing with each of you, because first and foremost, that I hear this word a lot, you know, over the past couple of months, is the word accountability, right? And so for us as practitioners, providers, and healers, I think first and foremost, we have to humble ourselves and make sure that, you know, we put ourselves in a place where we are able to accept ridicule and be able to learn from all of you. Because for the most part, we have knowledge, you know, but knowledge applied is different than knowledge in the books. And so what I've learned over time is that when I speak and I actively listen, I genuinely look to understand, that is when we move forward with leaps and bounds in health. And so first and foremost, what I believe, these are all just points what I believe that I should be doing. So I can't speak for everyone else, because, you know, this panel is crazy, and I'm extremely intimidated to be sitting on this panel. I don't know if I actually belong here, but for me, I can share what exactly that I feel I need to do to become a more competent and you know, a better healer. And again, first and foremost is always just to act in humility. And so humility and accountability. The second thing that I hear oftentimes, especially from our kupuna, is that they're looking for spaces, whether that be physical space, mental space. They're looking for spaces to heal. And so that's one thing that we're looking to address with our space, is providing us an opportunity for places for practitioners when they go and they're sought after and they're looking to heal. They need a place to send people to gather and send people to prepare things. And so we're looking to try and create these spaces. You know, we have our Native Hawaiian health system here on Maui, Hui no Kealoha, creating spaces, right? A space where we can come together and begin to heal. So for me personally, I've taken on this project because I do my best, again, to listen. And this is what I'm hearing, I get aunties coming to me be like, you gotta grow this type of mamaki, you gotta grow this type of olena. And I'm like, I better learn more about aina and farming because this is what they need, right? And there's different types of healing, which I'll go into in a little bit more. But the third, of course, is building relationships of trust. So one thing that we notice a lot, and again, I practice in a different setting than all of these other providers here, but building relationships of trust are key and important because, there's the auntie, the uncle, the tutu who's not going to go to a health clinic or a doctor's office because there's no relationship of trust. There's no relationship at all. And so our role really is not to hit our metrics. That's something that's always preached about, all going up, moving up to the system through school. Hit your metrics, hit your numbers, we're no longer numbers, we're people. And so building relationships of trust, and that's really what I enjoy when I go and I converse with my patients and speak to them. They're excited to tell me about their vacation. They're excited to tell me. I get Auntie Donna right here. She tells me all kinds of stuff about any kind of stuff. So they're excited because we're building relationships, right? We're not looking at our bottom line. There's you can always make more money, right? But you can never. It's a quote. You can always make more money, but you can never make more time, right? And time is the only thing that all of us have in this room that we can give of freely, but we'll never receive back again. And so we have to be choosy with who we share this gift with of time. And so for me, there's no better gift than to converse and to build relationships. And so that's for me. I'm still working on that and still trying my best to implement that in my practice. And for me, what I'm focusing on right now, specifically over the conversations that I've had over the past couple of months, is to focus on my own personal, my teams, and our community, the well-being and cultural wellness, right? So there's a difference between, which is my next point, is the standards of care and Kanaka care, right? Because the standards of care is derived from clinical practice guidelines and things that, really don't relate to us. But for me, I'm asking you, I see that you have all these comorbidities and diagnosed diseases, right? But my question is, how's your spirit? How are the burdens that each of us carry right now? How are those burdens, whether that be to malama ohana or whether that be to, just fighting the demons that we all have? How is that? That's really the most important thing that, for me, I need to work on and focus on throughout, I guess, the remainder of my next reflection point of whenever that's going to be. But focusing on well-being and not just here's your medicine, let me know how it is, in a month. But really just be like, hey, you seem a little bit burdened. How are you? And asking that question with intention to honestly act upon the answer, whether the answer is good or bad. I'm working on that. And so for me, if I would, or hopefully, it's my hope one day I can be considered a competent, provider and practitioner. But that really is the key for me to focus on. And lastly, again, I believe, and this is something that collectively I think this panel can address, is really just rewriting what exactly is the standard of care, right? So why are we, so focused on meeting Western metrics? When we have unique, very extremely unique, unique to anywhere else in the world, right? These metrics that that don't matter to us, we need to rewrite and kind of just reimagine what exactly our standard of care should be. And so for me, these are all things that I pondered about and thought about, that if I were to be a better provider and if I were to be a better healer, that I need to focus on all of these things continuously. And, okay. Oh, going. Oh, green. I don't know. So I wanted to, I just had a training. We have a team. So we have a team of mahiai that we're working We're working this space, this aina that hopefully in the very near future, our lahui and our practitioners can come and just gather. There's no cost, no charge, but we're creating this space. And so we are touching base with different people and making sure we have what they're looking for. And so, sorry. So in our training, this is our last month training, each of our mahiai are kahu to a specific plot or space. Just because over time, this space is growing and it's becoming a lot more needy, I would say, as far as maintenance goes. So every time they go to the space, I ask them to lomi their space, right? And it's an acronym, and this I felt was 100% applicable to us as providers to apply to us as we care for our patients, right? Just as they care, it's no coincidence that just as they care for the aina, it's the same thing as we care for our people and our patients. So the first and foremost I ask them to do is to go to the space and learn to love the space. Learn to love the space and find ways to show that love, right? Whether that be weeding, whether that be raking, whether that be putting in the work, but learn to love. Same as us, we have to take time to find ways to learn to love our patients. And then and only then, that humility component comes in and we acknowledge that, hey, I may not be the right healer for you, but let me put you in a place or position to heal and connect you with the right people. So the first and foremost is to love. The second is to kilo, or to observe, right? You have to observe the space, observe the plants, the pests, the skies, the clouds, the winds, the rains. Observe, because we have to be the experts of this space, just as how we need to observe every aspect of our patient, right? The demeanor that they come into, because, a lot of us are, for lack of a better word, we're proud, and we're going to say, oh, how are you doing? Oh, good, we good, no worries. But only now, specifically over the past probably 5 or 6 weeks, a lot of Kanaka that I speak with, now a lot of the trauma has been triggered, and they're Cory, I cannot carry this. I need help, right? And it's come to that point, and so for us, we need to continue to observe and be mindful of that. The third is to malama, and to care for, and that again, it's all encompassing, or we have to make sure that we're doing everything that we can, because all of our resources are fixed and they're limited, but we can do what we can do, right? And so to always do that. And then the last thing, of course, is to just immerse ourselves in the space, immerse ourselves in the land. For providers, immerse ourselves in our patients and become a part of their care team, a part of their life. And if we can do that, for the most part, we become, or we take steps further to become a successful and competent provider. And so that really, for me, is my take. And, again, I created this with the intention to converse with you all. And so I would love to talk story with you guys, after this, and hear what you guys believe, we as providers need to work on or to do better. So.
Mahalo. Okay, tossing the ball now. Please.
Aloha. I'm Nicole Apoliona. I'm a family physician here on Maui. I'm in the first graduating class of family residents from UH Japsum. I've been on Maui for about 30 years. My main job since I've been on Maui has been a family physician at Kula Hospital. I was there for 19 years doing primary care, emergency medicine, long-term care, and also I was the medical director for the last 12 years. I left that position in January of 2022. I say I'm retired for now, which means I'm taking care of my family, and I am waiting for my third act, which is coming, and I think what I'm going to talk to you about today is part of it. And I'm going to take you, I'm going to be a little wonky. I'm going to do my policy wonk thing, if you don't mind. I'm going to take you through some numbers that I think are going to shock you. I want to talk to you about the Hawaii physician workforce shortage, because as Kanaka, who are dependent on healthcare systems, when you get to the point of needing a physician or needing a hospital, your care is only as good as the care that's available to your whole community. And on Maui and some of the neighbor islands, we're dependent on very few health systems. On Oahu, you have choices. Some choices. On the neighbor islands, we have far fewer choices. So I'm going to walk you through a little bit of a busy slide here. And this, I'm going to focus on the primary care physician shortage because we have very little time today. But these are numbers that are from an annual survey that's collected by AHEC, our Office of Area Healthcare Education Office based out of JABSOM, UH, numbers collected by Dr. Kelly Withy, reported to the legislature annually since 2015. We have been tracking this problem for almost a decade, and the needle is moving very slowly. So I want to start, if you start all the way to the right, the state issue, so I'm comparing 2018 numbers to 2022 numbers. The numbers on the top are the actual shortage of physicians based on a microsimulation model that takes into account age, ethnicity, chronic disease, insurance coverage, and our geography on each island. So the numbers at top are actual numbers. The numbers on the bottom are the percent shortage from our calculated demand. So I'm going to focus for the numbers on the bottom. Far right is the whole state. So 2018, we're about 20% shortage for primary care. 2022, about 15% as a state. Now go over to Hawaii Island on the opposite side. 2018, they had a 25% shortage in primary care. 2022, it's down to 9%. Honolulu County, 18% went down to 14%. Kauai, over 23%, it went down to 0 in 2022.
Hello. So in general, if you're not graph friendly, lower number is better.
Okay.
The goal is 0. It means we have exactly how many docs we need for our lahui. So every time it goes from high to low, we go, yay! Cool? Okay. So we said for the state, it went from 20% down to 15. So we're, yay! Hawaii Island, 25 down to 9. We're, yay! Honolulu, 18 to 14, kind of like same, not that exciting. Okay. Kauai, 23.8% down to, you see, being the oldest is festive. And drum roll, please.
Maui County, 28.7%. During this time period, everybody else is going down. We increased 36% shortage.
Thank you for the sound effect. Correct. Ooh. Okay.
Okay. So this is the problem, right? Not very many people are aware of this. Oops, I went too far. So I would like to talk to you today about the solutions to this problem, and I think the foundational solution is education. We need to educate more physicians in our state, on our islands, in our neighbor islands. National data show that if you go to JABSOM and you finish medical school here and you do your residency in Hawaii, 70% of those people stay in practice in Hawaii. It's the highest retention rate in the country for med school and residency in the state. So we know where the money is. Let's teach people here. The medical school is limited. The training sites on Oahu are limited. We need more space, more places. We need to be training more on the neighbor islands. And when people go to work on the neighbor islands, they learn what the community is. They learn what the people are there. They learn that they can practice quality medicine there, which some people on Oahu don't think is true, but it is true. So these are the solutions. The statewide innovations are things that JABSOM is doing now that are available to every island okay? Every island can have third-year students there for 6 months, and Maui does. Every island can have summer students there in the summer between first and second year. Every island can have second-year students for a couple weeks, or a couple months, sorry. Every island, if you're a practicing physician and you're precepting medical students, you can get a tax credit at the end of the year because you spent your time in service to education of future physicians. Okay, I want to focus what's going on that's new and innovative on Kauai and Big Island. Here's Hawaii Island. In 2014, Hilo Medical Center, HHSC Hospital with Hilo Medical Center Foundation started a community-based family practice residency outside of the university system. It is certified, it is accredited. They had their first graduates in 2017. You saw the primary care shortage numbers go down. This is how they're working on their primary care shortage on Big Island. It works. It's a lot of work. It takes community. It takes a lot of people partnering together. It takes investing in faculty there. It takes the whole community supporting this type of a program and the trainees. But it works. They also have a house there that was purchased. Housing is, we know, you've been talking about it for days. Housing is such a huge issue. They have a house that was purchased by Hilo Medical Center Foundation, and students rotate through. They have cars there. The goal in educating physicians and residents on neighbor islands is you get on a plane, you go to work. You have a place to stay. You don't have to ship your car. You don't have to look for your own rental, which is what we've been doing for a decade. You get on a plane, you go to work. And they also have A.T. Stills University. That's a doctor of osteopathy school. They have a campus in Waianae. Those physicians are rotating, those trainees are rotating on the Big Island also. If you train somewhere, you can fall in love with it. You can fall in love with those people. You can fall in love with those places. You can fall in love with your mentors. Kauai has a really exciting program that just started. So this is not reflected in their drop. I mean, their drop had to do with the community coming together, the district health office, HPH, who is running the main acute care hospital there, HHSC, the FQHC, and the Native Hawaiian Health Office, which are in the same clinic there. That's an innovation for that island. Multiple levels of support in one clinic. But now they have just started something called the Kauai Medical Training Tract. Priscilla Chan and Mark Zuckerman Foundation donated $10 million to fund this. And the medical school, as soon as they got the donation, the next year the program was up and running because they had physicians, hospitals, clinics on Kauai ready to roll, partnering already and ready to roll. They have 6 students, full ride, medical school scholarship. They have a connection to Kauai, or they're from Kauai, or they want to practice on a neighbor island when they finish. And when they finish, they have a 4-year commitment to practice, payback commitment to practice on Kauai. So 2023 was the first year of students in this program. The community loves it. The mentors and faculty love it. They have 35 volunteer faculty, clinical faculty on Kauai who are teaching in this program. And the students on Kauai feel like they are getting more experience with patients face-to-face than the students on Oahu. And there's a huge demand to get into this new pathway, the Kauai Medical Training Tract.
Exciting. Woo! So there's a hint that I saw you building across those things about a recommendation.
Right.
A recommendation. Maybe about what Maui could do.
Right.
Okay, so we're going to come back to that with you, okay? We're going to talk Rex for Maui in a bit. Also, sorry, I was very Kana'iaupuni song-oriented. Anybody here from the continent, the Ainae, Mokuhonu? Anybody? Hi there. I meant you too. You just don't make that much noise at these things. I know. Be louder. Okay, welcome. All right. Dr. Daniels.
Oh, Velina mai kako. Okay, so I'm going to do something different. I'm going to have you guys close your eyes. Well, not yet. Where's the, sorry. Technically challenge. No. Okay. Close your guys' eyes. No cheat.
Okay.
So place matters. Place is about geography, but also about memory and imagination. People make places even as places change people. Places are secured by individual and by collective struggle and spirit. Places where culture is made, where traditions and histories are kept and lost, where identities are created, tested, and reshaped over time. When you're ready, open your eyes. I saw this quote or this mana'o when I was walking through the Museum of African American History. And I thought, you know, this reminds me of home. And I think it's very fitting for us to think about this, that place matters. We heard from the new Kapohana talking about her connection to Maui. We talk about that all the time, how we connect. And that's something that's of strength and resilience for our people. And so I think I want to start there because Cory shared a lot of things. Dr. Apoliona shared a lot of things. How does it relate to us? How does it relate to you? One of the things I gotta say is, kind of like Aukahi shared, she's a diabetic in progress. I lead Native Hawaiian Health, yet I didn't have a primary care doctor for over 7 years. And that was for fear of being exposed as another sick Hawaiian. That was fear of people knowing my stuff in a small community like Maui. And Dr. Apoliona knows this. I actually was going to go to her before she retired. But then I found my PCP. And, and then I found the pharmacy, Mauliola. And so I think we all carry these levels of stuff as Kanaka. And so, who am I? I think it's really important to understand what I represent in terms of the professional hat I wear. So my mo'okuauhau is of Papa'ololokahi. We are the Native Hawaiian Health Board. We are one of 3 codified federal laws that are on the books that protects Native Hawaiian health. And so the kuleana we have is basically kind of this. Our kuleana is to uplift and raise the health status of Native Hawaiians to its highest possible level. And we've been doing this for over 35 years. And people often tell me, I never heard of you. Who are you guys? You never heard of us because we don't get a lot of resources. And that's not an excuse, that's a reality. So the challenges we had before August was plenty. And the challenges that we continue to see and experience is even more. So that's our kuleana. We also have this really cool thing that nobody ever triggers with us, and that we actually have consultation ability with federal agencies, and that's written into our law in the Act. So if anybody want to Google Native Hawaiian Healthcare Improvement Act, go take a look at it. The other thing is we have 5 Native Hawaiian healthcare systems. Cory mentioned Hui no Kealopono here on Maui, and across the state. So they're quasi-FQHCs or federally qualified health centers, but for us, our kuleana and our focus is Native Hawaiians. We serve everyone. And what we hear a lot from our community is, we don't go over there because that's where all the poor Hawaiians go. I'm sorry. No matter, you come because the services we provide is focused and intentional for you folks. And then we also work on protecting and perpetuating Native Hawaiian traditional healing practices. And I really want to say that, Native Hawaiian traditional healing practices. I think we all understand that we all believe in indigenous healing and those arts and practices, of course. But for us at Papa, our kuleana is for our Native Hawaiian Kanaka. And so that's who we are. Take a look at our website. Take a look at our NHPI COVID response website. We do a lot of things in language, a lot of educational pieces. And like Cory, if people want to talk story after, come. I think one of the things, and we'll talk about this in kind of what our next steps are, is, so how do we do different? How do we be different? So I'm going to leave you, before I pass it over to Dr. Fox, I want you to think about musical chairs. It's going to come in handy later. Think about musical chairs, and that's what I'm going to leave you with as I turn my mic over.
Intriguing. Thank you. All right, troublemaker, you're up.
Kealoha no kako. My place in the system is really 20 years in the making. This is my 20th anniversary of working. What started in healthcare, I worked in behavioral health and applied behavioral analysis, making sure that our keiki and the Hawaii DOE had access, especially keiki on the autism and special needs spectrum, had access to services. 20 years later, as a millennial, I'm tired of waiting, and I'm tired of having the constant conversations that tap dance around statistics. And as Aukahi said, that's what I do, right? I turn statistics into plans because I have this motivation, I have this energy, I have this desire to not sit idle anymore and to do something about it. And so that's where I wanted to start with place today. If we walk away with anything in the motivation from today, I hope it's that in my own 20 years of doing this work in so many different organizations with so many incredible leaders and getting all of those fancy letters after my name that my family says I have to stop doing, by the way, we have to turn from health care to aloha care to Kanaka care. And no one's going to do it if we don't do it. We cannot wait anymore because I can tell you, I work in so many parts of the system, whether it's federal, I report to CMS, the Centers for Medicaid and Medicare Services. I report to the Hawaii Department of Health, the Hawaii Department of Human Services, and the Hawaii Department of Education. No one is going to do this if we don't do it for ourselves. And so one of the things that the kupuna had asked me to do was to find a way, was to learn the occupier's tools, to learn statistics, to learn biomedical science, to learn data analysis, to tap dance around every single CPA and financial analyst that says we don't have the funding to do this, and to prove them wrong that these systems have more than enough money. What they don't have is any mana. And so it's our turn to make sure that each and every one of us ho'omana this system. And so the only thing I wanted to share with you today is how we're doing that at Aloha Care. We have a fabulous and amazing board. Our current board chair is Dr. Mary Oneha. Our immediate past president is Dr. David Duroff. And we've been able to provide these 6 services that we call value-added services at absolutely no cost to Aloha Care members, and that includes for the first time ever anywhere in the United States or in the Pai'aina to make sure that Aipono, Hula, Lomi Lomi, and Ho'oponopono are covered by a health plan and are offered as free services. And I really just want to say that it is place is also about pilina. It's not just our pilina to place, but it's also about our pilina to the mo'okuauhau of each one of those places that we experience. And if it wasn't for Sheri being a past board member at Papa and our co-working together, I don't think that we would have been able to see this happen at the rate that we have in less than 4 years. And I don't think that we're stopping here, and I hope that the conversation can help us move towards the future really, really quickly. If we have a couple of minutes later, I'll show you just 5 things that I think that we can do to move from health care to aloha care to Kanaka care.
Mahalo nui. Okay, guys, I know we have lots of stuff you can clap about. There's totally brilliant people in key spots that weren't there before. So lots of times people go, when we look at Hawaiian health statistics from the 70s and 80s and we look at Hawaiian health statistics in 2023, they don't look that different.
Before I was born.
Right. Oh, thanks for rubbing that in, by the way, babes.
But they don't look any different.
Right. They don't look different. And everybody goes, see, so why? All that was poho. It's like, wait. If not for the folks holding the line where they are, those statistics would be far worse. We die in pieces slowly unless we can do these things that hold us up and go. Sorry, can't help it, moderator, gotta say my thing. Here's the thing, I have a question for all of you. Are you ready? You're gonna do it by applause. How many of you, okay, I'm gonna give you the categories and then you're gonna give me the woot woot if you think that's the most important one. Several factors contribute to the health of our lahui, to the health of you and your ohana. I'm going to give you some categories, and then these guys are going to give us recommendations after that fall in those buckets. Hikino, because we got like 15 minutes, so now we're doing speed jeopardy, yeah? Okay. Over here, I'm going to start furthest most distal out. We have the health of our aina, our water, our air, and the globe, okay? Over here, whoa, okay, hold on, I know, hold on. Furthest out, right? Biggest picture, right? Over here, Papa Wakea, over here, okay. Over here we have formal structures and systems, policies, funding from the organizing leadership, the nations you belong to, the states you belong to, the organizing bodies, how they make rules, plans, and policies, how they decide if your city has streetlights, how they decide if you get to go to the park and if it has a bathroom, okay? Over here I'm gonna go, how we all have to afford or pay for health care to happen, health and healing. I'm going to do both. So however we get folks trained to do those jobs, have them stand up somewhere where they can take care of you. The quality of the interaction that you have with any health practitioner or healer. So what happens once you show up at someone who knows things? And then what you do at home with your peeps. Okay? I want to hear applause from way out here with Papa and Wakea, with the health of our aina, water, soil, all that. How many of you, what percent is this? I have a strong suspicion this room is going to run out of claps. Okay, how much does it matter about the policies that your lahui puts in place, structures, systems, parks? Okay. How much does it matter that we have enough doctors on Maui or that we have enough healers in our neighborhood? Okay. How much does it matter the quality of the care that happens, the pilina with the place you go to get healed? Oh, drama lighting. I love it. Okay. And how much of it has to do with what you and your ohana and community do in your hale? Did any of you notice a bowed kind of upside down rainbow? Where the biggest woot-woots of joy came from Papa and Wakea, water, natural resources, and all the people who came for Ola Ikawai. And then on this end, what we do at home with our ohana. Did you guys notice? Maybe? You don't believe me? And the middle, we all clap. They all matter, yes? But much of that is unseen, except for that one about how the clinic makes us feel. Me and my gang, we work out of Hui no Kealoha, that's our pilina. How it feels when you walk in there matters. It matters. Does it matter more than what you and your ohana can do? If you have a house, if you can buy vegetables, like that kind, right? Does it matter if the water that you drink because people told you to drink more water is lepo? So these two sides matter in terms of health, but all the stuff in the middle has all these unseen things that you might not even know are in motion that are actually vital to your health and well-being in your ohana. So I'm going to toss it to the panel now, and I'm going to say, please give us, because we have umi minuke ikoi, I want you to give me one of the most powerful things from your porch that can be done or is being done to improve the health of an ohana in this room. Can we do it like that first? And then we'll add all the window dressing later. But I'm going to beg you to speak from various parts of this upside-down rainbow, okay? And label where you are in the system. Can we do that? I know, 10 minutes. So you got to say them, you got to give me your version 2.0, say them tight, because then you get to say 3 more if you say them tight. If you tell me your whole, the kind, we got 1 each, okay? Are we ready? Dr. Fox, you're first, because you were so gracious to be last. No? No? Okay, we can play Who Wants to Go First? Hot potato. Ready, go. You guys have a mic?
I'll go. I'll jump in, because mine is very focused, and you know what I think. I think, in general, we need to educate more physicians. How do we do that? We need partnerships on every island, and I think that's where Maui, that's the first place we need to start on Maui. We need the hospital system. We need the clinics. We need Hui no Kealoha. We need the physicians practicing in the community to come together with our legislators, with our council members, with our communities, and say, this is a community priority for us. There is so much going on Maui right now. So much going on. Tears came to my eyes when I walked in here because I could feel it. All of us together in this place and everything that we're carrying. And everything that's happened has unearthed the systemic problems, right? The issue with the water is the issue with the land, is the issue with who's running our healthcare system on Maui. So as we're doing all this other work, if we can come together, if you can keep your eyes open, you have this piece of information now that you didn't have before, that not very many people have, because it's not out there. Let's all work together. I'm going to work with my grassroots physicians group. I'm going to go to the hospital. Keep your eye out. Keep your ears peeled. Say what you need to say when you have a chance to say it, please.
Mahalo. You're up, dude.
I'm on this side, Ohana. I am fully committed and bought into the concept of having a healer in every home. And so my one hope or recommendation to each of you is that if you identify a healer in your home, whether it's a keiki, whether it's anybody, encourage and nourish that desire. And it doesn't have to be in a clinically medical setting, right? If they are
Although we really need lab techs.
Oh yeah. We need lab techs. We need medical doctors, and
we really need phlebotomists. Yeah.
But for the most part, if they have a desire, if you notice that they have that light and that desire to help heal and whatnot, nourish that, because we need that, right? We need. I was doing it in my head just now. I had over the past about half decade had about 13 interns, right? Pharmacists who are about to become licensed. 13 of them, of all 13 who are from Maui, one of them stayed, right? So the other 12 are practicing now on the continent. So do everything in your power to nourish your healers in your home now. And of course, over time, they'll gain knowledge, but please take time to nourish the healers in your home.
Mahalo. Hit it.
I'll ask the tech team if they can put the slides up just one more time, because I'm going to do mine really fast because we're rapid speech today. I'm going to hit it. I actually brought 5 things that I hope that we can do, and I really want to make sure that we have an opportunity to talk to it about this after this panel. So if the tech team can put the slides back up really quick, I'm going to show them on the screen so I don't have to run through them all. But if we fulfill our kuleana, then I think we have a better opportunity to make sure that we have attorneys and policy makers and advocates like those that are in the room today. We need more John Chings, we need more Mallory Hees, we need more Malia Kuragawas, we need more Noi Goodyear Ka'opuas to make sure that those parts of the system at the systems level are not being ignored. I'm a Papahuli person through the EKF model, so I like to be up in that va. And then the other place that I really wanted to talk about was the opportunity to invest. And we have to ho'opuka all of our resources right now. We have to be able to pool them together. And I think those are conversations that we've been having to make sure that we can be the good stewards of these resources that we do have. I cannot say this enough. Western healthcare systems have more than enough resources. They just don't have the money, they don't have the foresight, and they don't have the plans and structures in place, largely because of the lack of local and Kanaka leadership, I might say, to be able to implement those that are grounded for us for Hawaii. And then I also just wanted to say that we have such a legacy of endurance, and I want to make sure that we have an opportunity to tell those positive stories that are retained within the genealogy and imprinted within each and every one of us. Sheri, Aukahi, Diane, and I, we've been a part of CNHA through the Health Caucus for more than a decade now, and I think it's an opportunity for us to invest in the next generation and make sure that we're not up here next time, that some of you are here and you're leading the way.
Take us home.
Well, sorry, I was gonna say a not nice word. Okay, so take your pictures of this because we're not gonna have time. But I mentioned musical chairs. I think what Kealoha talked about is really important, but we need to be multi-pronged. We gotta be strategic. We gotta play that game of konane. So if Kealoha's, her space is data, I'm going to deploy her. If Aukahi's is the distraction, get people together to talk story, I'm going to deploy her. right? We're going to have to really recognize where our spaces are. And then we deploy, and we're going to have to trust. We're going to have to trust each other that I'm not going to cut you off at the knees because it's going to benefit myself. That I'm going to come back and hooey-poo with everybody and talk about what I learned, and we're going to compare notes. We're going to talk about, hey, you know, if we go down here, this is going to happen. Okay, well, we go try. And you know what? If we fall and we fail, it's okay, because we went try. We're going to get up, we're going to reposition ourselves, and we're going to try again. So I talked about my musical chairs. Okay, so we all know musical chairs, correct? Song plays, we're over there, and then next thing you know, right, we hip bumping off. Aukahi will probably hip bump, elbow bump.
Hula dancer, kikala, hikino.
Right. And then it ends up with two people, right? Ends up with two people. And we know that there are certain factors that allow for the success of one person to win, right? Who's the strongest? Who's the fastest? Who's the most cunning? But if we change our perspective and we think about winning, because we all want the same goal, we like win. But we need to understand what the factors were that led to failure. Failure is not bad. We need to know what the factors were. And many of those factors are beyond our control. We don't know, we cannot control the music. So is Aukahi who's controlling the music, does she really like Kealoha? So if it's me and Kealoha left, am I odd man out already?
If you don't like 90s R&B, you are.
I'm just saying, right? Like, think about it. We don't control. So we have this thing of we all make, right? We all have friends and we do that. And that actually is part of our detriment. Is we gotta move away from the who's who and what, and we gotta look at who actually doing the work. And it's okay. It's okay that we do the work. Because you know what? You're going to need the people who's over there making friends. We need everybody. Just like, right? We need the people working at McDonald's. That's probably not a good health thing, but we need the person working at McDonald's just as much as we need the doctor, just as much as we need anybody else. So the other thing is, so there's far more. But if you guys get time, go Google or YouTube musical chairs. And look for the one where they have a shared win. So there's a video where you can play the music, and then both of us can sit on the chair, and we both win. Now, if our LMUs no fit, then that's a problem. But we're not there. But right,
Size equity, baby. Bigger chairs.
Make bigger chairs. We can build. We know people. So, but right, if we can share the win, we're more strong. So when we're going to advocate for dollars, when we're going to have those conversations, we're going to win collectively, not individually. And so for me, I'm in the middle in terms of policy and all of that, because I'm not in the showy part, I'm not in all of that, but you know what, I'm in the spaces in DC, I'm in the spaces where we're talking about what does it mean for our Kanaka, and we're Kanaka 24/7, 365. I don't care where you live, I don't care any of that. You Kanaka, whether you here on Maui, you on Oahu, you're in Maryland, you're Kanaka. And I'm really, it hurts when I hear Kanaka tell me, oh, it doesn't matter because I've been here on the continent too long. I grew up here. No, I didn't know that when you fly across the Pacific, all your koko leaves you. I didn't know that. So if we want to uplift our Kanaka, then we better practice what it means to be Kanaka. And it means that we may disagree. I don't always agree with Aukahi. I don't always agree with Kealoha. But we agree to disagree. And we have conversations. Even when it's hard, we have to mihi. And we have to know what our kuleana is and stay in that. I think we all know that. And so that's mine. Musical chairs. Yeah.
Mahalo. Mahalo ho'i kako. We're at the end of this panel. There are a couple of really wonderful opportunities to convene to talk about health. The kauka are up and open this afternoon. There's like a talk story sesh later. There's a QR code I'm supposed to reference because this panel was graciously sponsored by Lily, not
Gary
company. And this QR code, if you are interested in seeing what they're up to and you go to the QR code, if you go back to registration and prove you did it, then you get $5 for the makeke. So, love a nice supporting industry situation. So hit it. We are so grateful for your time and patience. Please be part of the Upside Down Rainbow and get us there, okay? Mahalo nui.